We are storytellers, all of us, staff and board and volunteers and members. We are storytellers, I think maybe first and foremost. Our goal is to provide support, education, advocacy, and training for people with mental illness. But how do we do that? By sharing our stories. And it's the stories that make people feel not alone. It's the stories that help us really confront our true feelings about a situation. It's our stories that help reduce people's biases against mental illness and people who deal with mental health issues. Um, the whole NAMI Stories initiative that we're moving forward with, getting people to tell their stories, is a big part of why, the big part of why we're doing that is to encourage others to talk more openly and more freely and more honestly about what their experience is. And we'd be hard pressed nowadays, especially since coming out of COVID and everything that's going on in the world. Um, we're all impacted in some way or another. Our mental health is impacted in very significant ways, whether you're in elementary school, middle school, or high school, college, in your career, or retired. Whether you're a parent or you don't have any kids. Regardless of your economic background, your cultural background, your faith background, we're all impacted in some ways. And the way to really share our common humanity, our common experience, is through sharing our stories.